Good afternoon, everyone, and welcome to this bright sunny day in West Michigan. Did I also say how warm it is out here as well? My name is Randy Eberts, and it's a great pleasure to serve as Vice Chair of the Bronson Healthcare System Board of Directors, and to be here today to host the virtual event that not only recognizes a great milestone in Bronson's cancer care program, but recognizes a very special individual who has been instrumental in Bronson's overall journey to excellence. Out of an abundance of caution, though, we have no audience here today, so I'm just looking at myself basically through the camera. But wherever you are, please put your hands together in a round of applause for our guest of honor, Bronson President Emeritus, Frank Sardone, and his wife, Susan Fall. When Frank retired last December, he left a multitude of accomplishments, but perhaps he left one piece of unfinished business. So we are gathered today in front of Bronson's new Cancer Center in Kalamazoo, which will open in January, to close the loop on that one outstanding item. Now by outstanding, I mean remaining as well as exceptional, and to honor Frank for his visionary leadership across 3 decades of service to Bronson and to the communities we serve. During his tenure as president and CEO, Frank made an indelible impact on the patient and family experience by enhancing quality, customer service, and the design of Bronson facilities. Always putting the patient and family first at the center of decision-making, the development in 2000 of the new Bronson, with all private rooms and a patient-centered healing environment, became and remains the role model for hospital design across the country and around the world. Those principles are reflected in this new pavilion where Bronson patients will receive their outpatient cancer treatment. While Bronson has been recognized locally, regionally, and nationally in numerous ways, Frank would always humbly spread the recognition among the Bronson staff and not for himself. Well, Frank and Susan, today we're going to change that. To tell you more, I'd like to introduce longtime Bronson board member, Don Parfet, who has worked with Frank since the early 1990s. Don?
It's true, I was board chair in 1996 when Frank Sardone was selected as the CEO of Bronson. In 23 years and 3 board chairs later, I was again the board chair when Frank announced his intention to retire. But let's roll back to even earlier than that. And remember that Frank was recruited to Bronson from his home state of Kentucky. He was a very strong performer with outstanding leadership potential, but many wondered whether Michigan winters might be too long, too dark, and too cold to keep him. Well, those fears went away when we learned of Frank's impending marriage to longtime Kalamazoo resident Susan Fall. And what a partnership those two have created. Not only did they commit to each other, they've committed themselves to our community, our region, and our beloved Bronson. Over the span of Frank's career here, we witnessed the conversion of a fine local hospital into a nationally recognized healthcare system. Frank led Bronson Methodist Hospital on a journey to excellence by focusing on evidence-based quality and exceptional service as the means to achieve high-quality clinical and organizational outcomes, such that in 2005, the hospital was awarded the nation's highest presidential honor for performance excellence, the Malcolm Baldrige National Quality Award. And Frank was just getting started. Throughout his tenure, Frank created key partnerships that resulted in growth and economic development, expanded medical training for physicians, nurses, and allied health professionals, enhanced and expanded Bronson services into a regional system with over 100 sites, and instituted a shared electronic medical record system to better connect care between providers and patients. These and so many other initiatives generated positive momentum for Bronson, resulting in our becoming one of the most respected independent health systems in the nation, and most certainly a key factor in attracting a best of the best workforce, including Bronson's new president and CEO, Bill Manns. And it is so nice to publicly welcome Bill to this community and his wife, India Manns, to Bronson. Welcome and thank you to Bill and India for making this region your new home. This has been a very challenging and trying first year, but we could not be more pleased by your leadership and unwavering determination to continue Bronson's great trajectory. Frank, your achievements are in good hands, and your spirited positivity is alive and well. You know, as a board, when thinking about Frank's legacy, we thought long and hard about ways to honor that. We recalled how Frank had early ties to the cancer care program here at Bronson. One of his early assignments as a service line within the service line administration at Bronson was the planning for a new cancer center of excellence. It was to be built above the old Bronson Methodist emergency room, and all the licensing approvals were in hand. Shovels were ready. But for the greater community good, we relinquished that plan, determined to pool resources with Borges to develop a joint venture called the West Michigan Cancer Center. For many years, it was a shining example of outpatient care. However, as cancer diagnostics and treatment approaches advanced, a new standard emerged requiring cancer patients to be better connected, both electronically and in person, to the other healthcare services they use as testing, surgery, primary care, emergency care, and on goes the list. Better connected, and in other words, all within their own home health system. And that led Frank and his team to initiate plans to move outpatient medical oncology back to the Bronson campus and into this new facility. And to honor Frank's legacy, we also thought about how Frank and Susan had experienced firsthand the challenges of being healthcare navigators for their parents when cancer struck Susan's mother and father, and then Frank's own mother. And now, based on their experience and the stories of others, Frank was always a champion. And he was always a champion for transforming care into a more coordinated and easier access. But finally, we thought about something else very special about Frank. Something everyone knows about Frank. He never forgets a name. And that brings us to today's naming ceremony. Frank, on behalf of the board, everyone at Bronson, and all the friends you've made over the years, we gather on this site to ensure that everyone will remember your name, your legacy, and your impact. Today, we are naming this building in your honor. Frank and Susan, please step forward and watch as this unveiling occurs. Whoa, whoa. From this day forward, the Bronson Cancer Center in Kalamazoo will make its home in the Frank J. Sardone Pavilion. Congratulations.
Thank you, Don, and thanks to all of you for joining us on this special day. I am going to try to fight back being a little bit choked up by this experience, but I just want to thank everyone that is both here out in this drizzle as well as the large number of people that were on the phone earlier building up to this. It's difficult for me to convey how humbled I am to have this facility named after me. It's an honor of a lifetime of which I'm most grateful. I can tell you though what's not difficult is expressing my gratitude to all the people, the many people who make Bronson what it is today. Especially during the time of this COVID pandemic, I must thank the nurses, the physicians, the therapists, the technicians who have been caring for patients during these unprecedented times. In addition, there are thousands of other equally talented individuals supporting these people every day. This means people cleaning and disinfecting rooms, preparing and serving food, maintaining facilities, managing business functions, and communicating to the public. And at the same time, there are others focused on developing services and facilities like this that the community will need. A facility like this doesn't just happen. Years of planning and analysis are required to develop a state-of-the-art cancer center. And it takes an extremely talented team to make a healthcare organization work. And we're very fortunate to have such a team here at Bronson, working now and for the future. And speaking of the future, Don introduced the new Bronson CEO, Bill Manns, earlier. I want to welcome Bill. We haven't had a chance because of COVID to get together much, but I just want to thank you and offer our best wishes to you and India for taking on the challenge of running this organization, leading Bronson. And also to the executive team for their tireless work during the most difficult of times. To the Bronson Health Foundation and the staff who have spearheaded fund development, which has greatly enhanced not only this pavilion here in Kalamazoo, but the program in Battle Creek and the pediatric oncology program. And finally, to the entire board of directors represented today by Don Parfet, Randy Eberts, and we heard from Nelson Carr earlier on the phone. Thank you for this tremendous honor and for your commitment to our region's largest community-owned and locally governed healthcare organization. Most importantly, thank you to our communities across Southwest Michigan who have supported this effort specifically and have supported Bronson in so many other ways. Thank you all for being here today, and thank you for the honor of a lifetime.
Well, thank you, Frank and Susan, for your poignant comments. And next, I'd like to invite our new President and CEO of Bronson to talk about Bronson's regional cancer program and the outpatient care that will be delivered here in this building in just a few short months. Bill?
Thank you, Randy. I'd like to say as Bronson's new CEO, my family and I are so grateful to be here and to have been so warmly welcomed, albeit mostly virtually, since we arrived in late March. Frank's legacy is clearly evident in the culture and quality of this organization, and it's my honor to be selected as the person to lead it forward. But before I specifically address our cancer program, I want to share a bit of what I've learned about our organization since I arrived. People often ask me what it's like to become the CEO in the middle of a pandemic. I first say, Frank had excellent, but then, more realistically, I say this. It's been humbling. It's given me an incredible view into the heart and soul of Bronson. Watching any team perform in crisis can be very illuminating. And what I've witnessed here has been truly amazing. The culture of positivity, the focus always on the patient, doing what's right for our patients, the care and support that providers and staff show one another, the teamwork, the innovation, and the resilience. And then there's the community, the empathy that our communities have shown for our local healthcare heroes. It's all been incredible. Many organizations talk about values, but Bronson actually lives them. Now, COVID-19, like cancer, touches nearly every family in some way. And while we look forward to science and research coming forth with a vaccine soon to reduce the scourge of this new disease, in the meantime, we have to wait. We have to continue our fight to care for Bronson patients on all disease fronts. One of the truths of COVID-19 is that it brought to light across the world the significant disparities in care and outcomes for communities of color. At Bronson, we are committed to closing this gap to ensure that care is provided equitably, such that every individual receives care according to their own unique set of needs. We are committed to stratifying our data, to look for and remedy any disparities in cancer care and other services as well. Here in the US, cancer incidence is growing as the population ages, with 1.8 million new diagnoses each and every year. Across Kalamazoo, Calhoun, and Van Buren counties, there's an average of 2,260 new cancer cases diagnosed annually. That equates to roughly 6 people each day being diagnosed with cancer, and we want to be there for them. A patient with cancer touches nearly every aspect of our healthcare system, from their primary care doctor, their medical oncologist, radiation specialist, to chemotherapy, infusion services, lab, diagnostics, surgery, rehab, and other therapies. We are very fortunate that our cancer program is a regional one, bringing together experts across all specialties to ensure the best possible care. In Kalamazoo, we will continue to partner with West Michigan Cancer Center for radiation and surgical oncology services, but chemotherapy and infusion services will be provided for adults in this pavilion starting January 18th. Bronson's Children's Hospital across the street will continue to be the premier destination for inpatient and outpatient care for kids with cancer from throughout Southwest Michigan. And Bronson Battle Creek's nationally renowned cancer center will continue to provide the full spectrum of oncology services for adults in the eastern part of Bronson service area. Some good news statistically, and I think we all need some good news on this rainy Tuesday afternoon. Cancer death rates nationally have declined by 29% from 1991 through 2017. This is in large part due to improved screening techniques, treatment, and prevention strategies. Hence, survivorship is expected to grow over 50% over the next 20 years. Our programming has taken this into account by surrounding the patient and family with resources and support before, during, and after a cancer diagnosis. We want to be your partners for life. Now, during this age of COVID-19, we're also focused on encouraging people not to neglect their care. If they're experiencing symptoms of cancer or any other disease, we want you to come. We want you to see your primary care provider. We want you to see our specialist. I can assure you, it's safe to go to a medical appointment. Bronson providers and staff are doing an incredible job of following strict safety protocols and cleaning practices. We're doing all that we can to keep our facilities safe and clean. Thank you for this opportunity to speak to you today. And Frank, my friend, congratulations on a well-deserved honor. Thank you.
Well, thank you very much, Bill, for those comments. And that now draws our ceremony to a close. While today we name this pavilion in Frank's honor, we know that he left handprints on this region in countless ways that are greatly, but also quietly appreciated. Let's also honor him by continuing our work to advance the health of our community and to deliver an exceptional experience for every patient, every time. Thank you for joining us. Stay healthy. Bye.